So in terms of like going back to incentives, recently I think the Canadian government, at least the federal government, has tried to say, hey, you know what? Provinces will give you a little bit more money for healthcare, or not little, a lot more money for healthcare, if you can provide back metrics that demonstrate that there is an improvement in care, right? So, do you think things like this, where of course having real time data probably would be quite beneficial, and be able to take unstructured data and then structuring it so you can do these measurements would be, it seems like it would be a huge need for that. Do you think this new dynamic would be helpful, or are there other dynamics that would be helpful, you believe, to spur innovation in Canada, especially in the healthcare space? Because of course you've gone through the ringer already, so we don't want others to have to go through the exact same ringer. Is there ways to make it easier for our organizations to still provide obviously a great product, but like it's not like making them jump through all these hoops that are somewhat unnecessary and do not really benefit the patient?
Yeah. So there's always going to be hoops. But to answer the first part of your question around outcomes based metrics and that type of alignment and the idea of value based care, the short answer is yes, absolutely. Right. I know, we've seen the benefits when executed correctly and, quality based measures. Um, so, that is a relatively easy answer around yes. Now, going back to some of the structural change management complexity, you're moving a large oil tanker to be able to get there, but it's the right point, the right turn will create the right behaviors. And quite frankly, clinicians I speak to, policymakers I speak to, hospital administrators I speak to, all believe in that outcomes based measurement. Again, they'll question how and what is the integrity of the scorecard. But from a principal perspective, the answer is yes. Now, to answer your second question, I'm going to unpack that word innovation because I would argue that Canada has actually led an innovation, but unfortunately hasn't been able to be the recipients of the treasure of those innovations. And that point hit home for me really clearly when, so Pentavere was nominated in 2023 for the Pre-Gallian Best Digital Health Startup Award, which for those who don't know Pre-Gallian, it's the equivalent of the Nobel Prize in life science. And I can talk about how on earth did a Canadian company even get on the radar as a function of our peer-reviewed publications. But we found ourselves in the gala dinner in New York City, as they were presenting the top awards. And of course, Ozempic and Novo Nordisk won Best Pharmaceutical Innovation in 2023. But what was startling is the president of Novo Nordisk got up and told their founding story. Their founding story is a husband and wife who were on vacation, who took a sidetrack to Toronto just to see it, bumped into a bunch of folks who came up with how to manufacture insulin, somehow got for 10 cents on the dollar the rights to that outside of Canada, and were able to commercialize that and create a tremendous amount of prosperity for that entire region. Number two, Ozempic. I don't know how many people in this audience knows, but I started doing GLP-1s was invented by a Toronto doctor, discovered by a Toronto doctor at Sinai, amongst others. Yet how much of that massive invention is going back to fund our healthcare system and create that prosperity? So innovation, we're incredible at, and we should be proud of, and are world leaders at. What we think about at Pentavere, then at HealWell, going back, is okay, how can we better commercialize? Not so the IP goes outside of Canada, but commercialization creates jobs, it creates sustainability, it reduces costs to benefit all of us as Canadians. And there is, a huge opportunity that we can get better at, but unfortunately doesn't have to do about innovation. All has to do with the first part of your question. Okay, if we pick something like quality-based measures, thinking through incentives in a small area, how can we get really good at executing that? And those are some of the conversations I know we're starting to have as HEOL AI and Well Health Technologies, given the footprint we now have, to see if we can contribute to those types of discussions. But it's again, it's not going to be easy, and it is a shift, and we should be sober at our track record in doing these things.